Hello, I'm Dr. Pat with Little Critters, and we have Pope today here, a 4-year-old desert tortoise. And he had been brunating outside, and he came out today, and the owners found that he was very lethargic, having trouble walking. And as you can see, we have nasal discharge and bubbles. When we examine him, obviously, that's the most obvious. He is occasionally opening his mouth when he's breathing as well. His eyes are sunken in bilaterally, if you look at that. And his overall body condition is not bad. When you look at the top of his head, if he'll come out, he still does have some fat pads on the top of his head here. And the shell, this carapace, the top shell, is overall pretty good. He has very small pyramids, but not bad. And then the plastron, the bottom shell, also pretty good condition. He is a male desert tortoise. You can see the shape of the shell. We have a longer tail. The other concern that we have for him, though, is he's very weak. If you notice, not really moving his back legs much. Even when I kind of pinch his toes, he just weakly kind of moves them. He's not raising up to walk. Some of the things we're concerned about with him are metabolic bone disease, nutritional problem where we have either lack of UV light or lack of calcium or both. He is housed outdoors, so it's probably not UV. And they need that, both the vitamin D from the sun or UV light and the calcium, to actually keep their blood calcium levels stable and to build bones. And if the blood levels go low, they start pulling it out of their bones and they can get very weak. We can actually have fractures because of that. The respiratory, I see very commonly this time of the year. Tortoises in general, and certainly the deserts, often will harbor mycoplasma infection chronically and a tortoise herpes virus, which is a respiratory infection in tortoises. And oftentimes when they get chilled, they get immunosuppressed and stressed, and then these infections that are already there flare up, and these are common signs. Often you'll see when these tortoises are walking, their eyes are a little bit runny, and they'll kind of use their front arm and rub their eye intermittently, and the nasal discharge and the breathing with some degree of difficulty is pretty common. A lot of times you'll see their shoulders moving as they're trying to breathe, or their head moving with more effort. So the plan for this guy is to get some blood work on him. We do brachial blood draw. It's the inside of their arm right here. Pretty routine blood draw, and we'll get a basic profile, which will have a CBC, which is red and white blood cells and platelets, as well as an organ panel that shows us what's going on inside, and then actual herpes and mycoplasma testing for him. The other thing we're going to do is get some calcium blood levels and some x-rays just to see what's going on inside, and then start him on supportive therapy, nutritionally with supplementation.